Uliance presents the Life Advisor Wellness Series.
When you get lab numbers, you'll get a total cholesterol, and you'll get a couple other numbers called HDL and LDL. The way I remember, H means healthy and L means lousy. Your healthy cholesterol should be somewhere higher than 60. Your lower or your lousy cholesterol should be somewhere lower than 100. HDL and LDL are two components, but you can actually ask for what we call subclasses of these lipids to understand what they really look like, especially if your cholesterol is higher than it should be. You want to know what that HDL and LDL looks like. Is it light and fluffy, or are they small and dense? And in all cases, the lower or the smaller and denser that cholesterol, the more negative effect it has on you. If they're light and fluffy, they don't have as much negative effect. So before you move into any medical therapy, that would be an area that you want to have dialogue with your physician. Now, the American Heart Association has also come up with two additional, and the list here, homocysteine and C-reactive protein, as two additional key markers for heart health, in addition to cholesterol. And let me tell you why. 50% of individuals that present themselves to emergency room have normal cholesterol. But when that individual is tested for blood sugar management, homocysteine, and C-reactive protein, these markers are a bigger indicator of diseased or a healthy heart. So let's talk about homocysteine. Homocysteine is the health of your arteries. Remember we talked about that resistant of the arteries? Well, homocysteine is a protein that starts to collect and it starts to gunk up the arteries. In fact, it is basically due to something called DNA methylation. And when that happens and starts to create an impasse, then if you have cholesterol that's out of control, it will collect and create problems. So homocysteine is a very good marker to have pulled. It's a blood marker. And guess what? You can take care of homocysteine levels that are high by eating a lot of grains and garlic and onions. Basically, it's your B vitamins. Another marker is C-reactive protein. That is a marker of internal inflammation on the endothelium, or that inside skin. If you have inflammation, and this, by the way, we don't know where it's at, but enough to know that you have it, that can be affected by things like fish oil, omega-3s. That puts out the fire of inflammation. But nevertheless, it's nice to get that marker to say, hey, what is my inflammation level? Again, it's a marker of healthy heart, or do I have some work to do? And in all cases, vitamin D is so important to heart health. In fact, they now know that if you go and have your blood drawn in the winter months, chances are your cholesterol levels will be higher than they are in the summer months. And they are attributing a lot of that to vitamin D levels. And vitamin D is a vitamin, but it acts like a hormone. In fact, the guy that discovered it, he called it a vitamin. It should be called a hormone. Vitamin D is created as the sun hits your skin, interacts with cholesterol, and then vitamin D is created. It's in every tissue and every cell of your body, and it's very intimately involved in heart health. One last one I want to bring up is something called fibrinogen. That is a blood clotting marker for those of you who not only have had perhaps cholesterol problems, but has also been on blood thinner, or you might have heard of medications called Coumadin or warfarin. Fibrinogen is the blood clotting mechanism of the blood. And you want to make sure it's at a certain level, and this is a dialogue you can have with your doctor. Some of the natural things that keep it in line are omega-3s and fish oil.